Hi, I'm Luke Williams, founder and editor of the XR Beat, where we track the business side of XR, bringing you all the latest developments in the enterprise market. Today, I'm joined by Dr. José Ferrer Costa, a medical doctor and PhD researcher in digital health, whose work looks at how XR can move from research and pilots into real healthcare settings. We're going to talk about where MedTech XR is proving useful, what still gets in the way, and what healthcare organizations need before they can trust immersive tools properly. So thanks for joining me, Jose, today. Really good to have you with me. To start, can you introduce yourself and give us the short version of your work? So what are you researching, and what drew you into XR as a tool for healthcare?
Sure. Thank you for having me, Luke. As you said, I'm José Ferrer. I'm a medical doctor, and I have this double profile. I'm also a XR developer, and that's how I started with XR. Actually, it started as a hobby in 2019, but then in 2021, I finally brought what I've learned how to develop for the metaverse as experiences in the metaverse into the healthcare institution where I work. So that was the first project that I brought in 2021 that was about taking care of the professionals, actually. It was an educational project focusing on teaching the healthcare workers mindfulness and emotional management techniques.
Fascinating. What an interesting kind of dual career, I suppose, you've had. There can't be too many people just like you out there, actually, in the market, I imagine. You might be one of a kind. So what was there a particular clinical problem or patient need that made you feel like XR was worth studying seriously?
Well, actually, when I was using it for, I wouldn't say entertainment, but more educational. I was working with an educators group with in the metaverse, but I had to look into the clinical evidence that was published about the use of XR in healthcare. So I got to learn that there was a lot of evidence from decades ago, even though when I talk to people in healthcare, doctors and nurses, most of them never heard about it or never heard or never used it. But it's been there
Mm,
for decades. And the use
mm,
cases that are mostly established are for educational purposes, for managing pain. This is a big thing, and also for mental health, especially for phobias and addictions. This is one of the biggest uh, use cases of XR in healthcare.
That I was going to move on to that actually. My next question. So give the audience an idea of some of the other kind of practical use cases. I think you mentioned pain management and rehabilitation and training. I was also thinking things like patient education, clinical planning, maybe mental health, that kind of thing as well.
Yes, the educational purposes can be both for the professionals and for the patients, because when we talk about healthcare these days, it's not about giving pills to people or treatments. We want them to get empowered and learn techniques on how to take care of themselves. So if you use XR as an educational tool, it makes it easier. For example, for pain management, we want to teach them emotional management and mindfulness. And if you do that with XR in a session with 3D animation, immersive, it's easier for them to concentrate and to learn that. So this is very useful for mental health and education. And then when we talk about anxiety, depression, or even suffering that could be avoided, for example, children when they go to the hospital and they have to have a blood extraction. This is a very traumatic experience for most of the children. And if you put a headset and they are under the sea playing with fishes and whales, they get so distracted that they don't even feel the pain. It's not that the pain is not there, but the pain hurts less because you're not focusing on it.
Mm. The modern day version of giving a child a lollipop or trying to distract them in some other way. Yeah, that's great. Okay, so you will know this better than me, Jose, but my understanding is that a lot of healthcare innovation and innovation in general with regards to XR gets stuck at the pilot stage. So from your research from your research and clinical experience, why would you say that some XR projects struggle to move into wider adoption and use?
Yeah, that is what I'm focusing now. I went back to school for the university to do a PhD research, exactly to try to learn why so many pilots that have very good results are not finally implemented and adopted in routine care. And that is what I'm studying now, the barriers and facilitators of implementing VR or XR in healthcare, because it's a very specific technology. It's not just screens. You're inside the digital content, and it makes a lot of complications, not only for the usage by itself, but also to apply it to the patient. So the biggest barrier, I would say, it's the training, learning how to use it, because it's not like turning on a computer and have the screen outside. It's very specific. So you need time and you need very good technical support to learn how to use it. And you need a lot of planning also. You need to know when to use it, how to take care of the headsets, how to prepare them before the use of the patients. Otherwise, when you are talking about healthcare, we are normally out of time. We have few minutes to prepare for an intervention, and we have a lot of patients waiting. So we don't have time to use a technology that requires a lot of setting up. So the two barriers are the human factor and the technology itself that's not so easy yet. It's getting better, but it's not perfect yet.
Well, that was my question, Jose. My follow-up question was, are healthcare organizations getting better at, adoption and rollout of these technologies, would you say?
Yes, because we know more about it. So we learn with the mistakes. We have experience with pilots that then it's not adopted, and then we try to learn why it's not being adopted. And mostly it's because there was no planning before starting the pilot. I mean, planning on how it would be adopted in routine care, because a lot of research projects, they want to make the whole project as a lab. And when you transform the product or the content that you tried in a laboratory or a fake reality or controlled environment, because you have an extra team there to support them, it doesn't work the same, because it's very demanding, the routine in healthcare. So you need to plan the pilot and make it implemented during the research pilot, the period, as it was the real life. So it's not about having a specific room, a specific time to use the XR. You have to try to blend it in the everyday care.
Okay, and I think all industry verticals suffer from some of those same issues. But one area where healthcare is probably quite different from other enterprise verticals is in adoption from the perspective of trust, safety, and evidence carrying so much weight within healthcare. So, what would you say that an XR tool needs to kind of prove or show before a healthcare organization can take it seriously?
I think the key here, I have a lot of friends developing XR and trying to enter the market, the healthcare market. And I think the key here is to have, before you even start developing the content, you need a clinician that's going to be the final user, put in the headsets with the patient, to be with you when you start planning for the content, because you can create an amazing graphic. You can create this very interactive game, but it's not really clinically interesting or impactful for the use that you want to do with the patient. So this has to be evaluated before you develop it. Otherwise, you waste a lot of time and money, and then you have a nice product, but it's not going to be usable.
So it's more about fitting the technology into existing clinical workflows rather than, asking clinicians to work around the technology. That's backwards, isn't it?
Exactly. I think that the most important thing here is not to develop an idea before you understand how it's going to be used. You have to in the perfect world, you would have the headset being used by the clinicians, and then they would feel the immersion. They would experience and learn the potential of this technology, and then they would tell you when and how that would be useful for what they do with the patient. So you cannot do the opposite. You cannot create the two and try to fit it in the routine care. You have to do the opposite. You have to
Yeah.
teach them the possibilities of the two and then talk to them to see if it's useful or not first, and if it's useful, exactly how and where, in which point of the care, the healthcare, they would be useful.
Yeah. Are there any common things that XR vendors sometimes misunderstand when they try to bring products into healthcare specifically?
Well, I think that's very related to what I just said, because they try to make something beautiful and impressive, because most of them come from the gaming industry, and
Yeah.
that's what sells the product. But for the healthcare itself, it's not about the graphics, not about the best avatar and the most uh, impressive tools. It's more about the clinical impact. So if you want to create a supermarket and you have the best graphics and you want to use it for cognitive rehabilitation, for example, for people with dementia to practice going shopping in a supermarket, it's not about the graphics. It's more about how you explain the tool. It's more about the interaction. For example, we have this project with seniors with dementia, and if you try to make them use XR with the hand controllers, they get so blocked with which button to push that they don't really pay attention on the game. So it's not creating the impact that you want. So you need to use, in this case, hand tracking, because it's much more intuitive for them to interact with the virtual elements. So you have to make it very easy for the patients and the clinicians to use it. It's more important than the graphics and the realistic environment.
Mm. Yeah, usability is key, isn't it, within this industry? Fascinating. Okay, so I've got a question for you, Jose. I'll ask you to kind of speculate. Where do you think that XR is most likely to become normalized first in healthcare? So is it professional training or chronic pain or rehabilitation or remote care or something else?
In my opinion, about health professional education is very useful, because especially for residents, if you want to learn how to take care of a person in an emergency state, you should try it with a virtual patient before you do it with a real person. So health professional education is very useful. Rehabilitation is amazing. Is another use case that's really useful, not only because it's motivating for the patients to do the exercises, but because you have a lot of extra tools that you can measure and follow up with the patient in the doing the simulation. And then pain management and mental health. Those are the four main areas for healthcare, for XR in healthcare.
What would make you look at a piece of MedTech XR, a solution, and think, yes, this one has a real chance of scaling and being successful over the long term?
If it could be like 2 clicks to have it working with the patient, this is amazing. The less steps that you have to get the actual simulation or digital content that you want to use, this is very important, because time is a key element. And then the usability for the patient it has to be adapted for the patient that you're going to use. If you're going to use it with people with no disabilities or no extra uh, complexities, it's one thing. You can do more graphics, you can do more steps. But if you're doing, for example, a simulation for educating children with autism, you need to be very gentle with the lighting. So for me, more than the actual content, I would talk to them before I even try the headset and ask if they did develop it with a guidance of a clinician. I think that's for me is the first thing I ask. Did you have a clinician or someone that talked to you before you even developed this content? If you didn't, this is a red flag already.
Mm. It's unlikely you're going to get it right just by guessing. Yeah, that makes complete sense to me, Jose. Okay, I've got a kind of bonus question for you then. So if you think sort of 12 months into the future, where do you think the medtech market with regards to XR technologies will be?
It's going to grow, it's for sure, because it's being adopted. When I presented to colleagues in other hospitals, they all wanted to have it also in their service because they see the value. They see it's not just a game. So it's starting to being taken serious, not like a toy, but as a extra tool that enhances the possibilities to take care of the patient. So it makes it easier to achieve the therapeutic goals. So one thing that has to get better is the headset itself. It's still a big chunk of hardware that the patients really struggle to use. If it's 5 minutes, it's not a problem, but if it's 50 minutes, 20 minutes, it's still very unusable for some types of patients. So the hardware has to get better because the softwares are already very good. I think it's also very important to promote it. That's one of the things I'm trying to do, is to present the results of our real life projects in medical congresses more than in the technical XR niche meetings, because people in the medical field, they sometimes they don't even think about XR as a valuable tool, but when they see it's being used with real patients and it's giving good results, they believe it.
Hmm. Well, what's a fascinating and unique industry, Jose, and it's certainly one that I will watch with interest over the next 12 months, and we will see if your prediction comes to fruition. That's all I have for you in terms of questions, Jose. Thank you so much for taking the time. I think there's a really useful conversation here around moving MedTech XR from interesting research and pilots into actual tools that clinicians and patients and healthcare organizations can actually trust and use. So again, many thanks for your time, and we'll speak soon.
Thank you very much, Lee.